Hey everyone, my name is Dr. Asma Zafar and today we are talking about sleep apnea. So, sleep apnea is a sleep disorder that affects millions of people and it is characterized by pauses in breathing or shallow breaths during sleep. Now, these pauses can last for a few seconds or even minutes and can occur many times throughout the night. Sleep apnea can lead to a number of health problems, including daytime sleepiness, high blood pressure, heart disease, and stroke. There are two main types of sleep apnea. There is one obstructive sleep apnea, also known as OSA, and central sleep apnea, also known as CSA. OSA is the most common type that occurs when the muscles in the back of the throat relax and block the airway. CSA is less common and occurs when the brain does not send the proper signals to the muscles that control breathing. Let's talk about the symptoms of sleep apnea. The symptoms that are very common include loud snoring, gasping for air during sleep, daytime sleepiness, morning headaches, difficulty in concentrating, irritability. There are a number of risk factors for sleep apnea, which include obesity, male gender, age over 40, family history of sleep apnea, large tonsils or adenoids, deviated septum, use of alcohol or sedatives. How is sleep apnea diagnosed? If you think you have sleep apnea, it is very important to see a doctor for diagnosis. The doctor may likely ask you about your symptoms and your sleep habits. You may also be asked to undergo a sleep study, which is a test that monitors your breathing, heart rate, and brain activity while you sleep. How is sleep apnea treated? So there are a number of treatments available for sleep apnea. The most common treatment is continuous positive air pressure therapy, which is also known as CPAP therapy, which involves wearing a mask over your nose and mouth while you sleep. So the mask is connected to a machine that delivers a steady stream of air pressure, which helps to keep your airway open. So this is the point where a dentist comes. Now, oral appliances are another treatment option for sleep apnea. So oral appliances are custom-made mouth guards that help you keep your airway open by repositioning your jaw and tongue. Oral appliances are less invasive than CPAP therapy and can be a good option for people with mild to moderate sleep apnea. So there is a strong connection between sleep apnea and oral health. People with sleep apnea are more likely to have a number of oral health problems, which include dry mouth, gum disease, tooth decay, and temporomandibular joint disorders. So there are a number of benefits to use oral appliances to treat sleep apnea, which include they are less invasive than CPAP therapy, they are more comfortable than CPAP therapy, they are portable and easy to travel with, they are less expensive than CPAP therapy. If you think you have sleep apnea, it is important to see a doctor for diagnosis and treatment. Oral appliances are one treatment option that may be right for you. That was it for today. Thank you so much. See you in my next video.